I'd like to introduce Dr. Michael Ripchinski. He's the medical director for clinical informatics. I love the name informatics here at Lancaster General. He's going to talk about MyLG Health, which is our health system's electronic medical record, and how it enables patients to become more engaged in healthcare consumers. Dr. Ripchinski provides clinical oversight for informatics initiatives throughout LG Health, including ambulatory and acute care electronic health record strategies and implementation. He's a family physician. He served as chief resident at Lancaster General Health's family medicine residency program and contributed to the development of the residency's website and personal digital assistant resources. He holds an MD degree from Penn State University College of Medicine and graduated summa cum laude with a bachelor's in science in biology and philosophy from the University of Scranton. Please welcome Dr. Ripchinski.
Thank you. So unfortunately, computers are a little bit harder to describe in 96 seconds, but I'll try to compress our presentation so you can get a little bit excited about MyLG Health, because we're excited to bring it to you tonight and try to get you engaged in your healthcare online. So in fact, even tonight, for those of you that aren't registered, we have a crew way in the back, on the top row back there, that can actually help you get registered tonight. So if you're interested in joining us on MyLG Health, and hopefully I can get you excited about it, if you're interested in signing up right online tonight, we can get you there. But otherwise, certainly go to register.lghealth.org and you can join us on the journey. You can see we're having rapid growth. Since the beginning of this calendar year in January, we've now just surpassed, as of this week, over 10,000 patients using MyLG Health, which is an extraordinary accomplishment. And just to put it in comparison, our friends to the west at WellSpan are just about 11,000 patients. You can see we're on track for growth over the next several months to the end of the fiscal year, hopefully approaching over 20,000 patients. Just wanted to give you an idea of all the physicians, providers, hospitals, and other entities that are contributing to this one patient, one record. I mean, surely we, as Dr. Beeman mentioned, have the power now of using one electronic record across all of our entities. So on the far left there, you can see our 1,200 medical staff are using the record, both at Lancaster General Hospital and Women and Babies Hospital. You can see we have over 9,000 users using the system, whether that's physicians, our employees, or those in the practices. And more specifically to the practices, we have 340 providers in 40 different practices. That includes primary and specialty care owned by Lancaster General, as well as independent practices in the community. And then finally, our two last points on this slide. We have over 250,000 patients that have data actively being seen in our record today, which is an extraordinary number when you consider Lancaster County and our size. And then also, one last piece in orange there, you can see we are now connected with 200,000 physicians nationwide that use Epic. Epic is the software that actually runs eHealth, our electronic health record. And because we're using Epic together, we now can have records transferred from any of those other Epic customers. And give you a little bit of a quick story on how I saw a patient from Group Health in Seattle just this past week at Walter Rommett. And in less than 90 seconds, I did get her entire 20-year medical record, including 4 allergies she forgot to tell me and 3 other medications she had no idea she was taking. That's huge value in the ability to exchange electronic records into the future, and I'm glad to be a part of that. Talk about engaging. What can you do in MyLG Health today? One of the biggest pieces of value is lab results and test results. Certainly patients love it, and they love it even better when they're seeing me at Walter Rommett. I do a chest x-ray at 8 o'clock in the morning. Our radiologists have it read within an hour, and they have it in MyLG Health before they even get home. I mean, you could never have a turnaround for results that fast without an electronic basis to do that. You can also ask questions online if you're concerned about something. Scheduling is another big piece, the ability to schedule with your physician or your provider to get back in for follow-up. Refills are obviously another big piece, to be able to request a refill online instead of calling the office, making a telephone call, and trying to reach them for that information. One of the things I'm proud of is we're continuing to advance our patient education resources available within MyLG Health as well. So if you're going out to try to find information about diabetes or hypertension, we can have that data for you right within one click. And then finally, one of the other big pieces of MyLG Health today is for moms to access their babies' records, whether it's shots for school or whether it's you accessing your parents' records as well to try to help them engage in their health care. So there's the ability to do that with MyLG Health. MyLG Health is secure. Our online access is safe and secure. All communications between you and your physician are over a secure encrypted connection. We value that. And it's just like your bank. Instead of emailing you medical information, we're emailing you a notification to go log into MyLG Health to check the message from your physician. So we definitely value the safety, security, and protecting your personal health information. And then let's talk about upcoming attractions. We're very excited in the next calendar year to begin work on electronic visits. The ability to have a quick visit with your physician, whether that's a urinary tract infection, an upper respiratory tract infection, even potentially acne, where we could exchange pictures and track your treatment via an online visit. Obviously, that'll expand over time into chronic care as well, but we're going to start with a little piece on acute care initially. Clearly, you can't advance a technology piece now without running into an iPad or an iPhone. So we're going to be able to offer MyLG Health on the iPhone and the iPad, and that's going to be a great experience for all of you to engage in your health. One of the other pieces not many people realize that you can do with these online personal health records is actually electronically send your data. And I put a picture of a glucometer for sugar here and a blood pressure machine. So imagine the ability where your machine was smart enough at home to actually send that data electronically so that your provider would be updated if that value was out of range for you. That's a really exciting opportunity for us in the years ahead. And then obviously online bill pay. Many of you want to be able to have the ability to go on and complete the bill and satisfy that bill right then and there. So we're going to do a little demonstration in 1 second here, but I want to have sort of 3 take-home messages today. When I work with patients at Walter Rahman, I always encourage them to ask questions and actually look at the computer screen with me during the visit. Many of you are already going to those sites we mentioned today that are using eHealth in the offices. But get engaged, look at the computer, ask questions, look for trends for your lab data while you're there with your physician. And I'm also very happy and excited to really take setting goals and tracking your progress forward using MyLG Health as a tool to do that. So we're going to demonstrate a little bit of that for you now, maybe about 5 minutes. So let me introduce Charlotte Walden. She's actually a member of our team leader from eHealth. She's going to help me do the demonstration today just so we can make it a little bit interactive. So what we're going to do here is let me sort of tee up the visit for you. Earlier in the day, Charlotte was actually Jane Lancaster. So you can see she was seeing me in the office earlier at Walter Rahman. And we talked about her diabetes, her hypertension, and her blood pressure, that is, and of course her lipids, her cholesterol. So during that visit, we took a look at all of her test data, and I also provided her with some patient instructions. And we set some goals in that visit today. So let me we're logged in now as Jane Lancaster in MyLG Health, and we're going to sort of walk through, this is Jane now at home later in the night, taking a look online at her record. First thing she's going to do is look at her My Medical Record piece on the left there. When she clicks on Health Summary, she can see the same exact problems that she saw with me earlier in the visit today. In fact, she even has a space to write notes to herself there about her diabetes or about her cholesterol. In addition, she can refill her medications right from this first screen. She can request those refills quickly, and she can also review down below her allergies and immunizations. Scrolling back to the top, she can review her test results. And this is really an important piece of the puzzle in terms of tracking your progress in your health care. You can see many test results, including cholesterol and sugars. She can review her last test result, which was yesterday, and now she can even click on old cholesterol results and her LDL, or bad cholesterol, and view them as a graph, which is huge value for our patients because they can essentially now look at a graph, and as you can see here, her cholesterol was falling, but then started to get a little bit worse and started to go up again. So that's one of the main reasons during the visit we set goals together. So in her message center on the left there, and then in the inbox, she sees a message from me indicating I'd like her to review the goals. These are her treatment goals, to try to lower her blood sugar at the top and then also keep her cholesterol in line with what a diabetic should have. So it's a great way for her to keep track and for me to message her to make sure we're setting ourselves up to achieve those goals by the next visit. She can also request medical advice. We mentioned messaging. Most of the messaging we do today actually goes to our nurses, and the nurses end up triaging those messages for the physicians, and the physicians can either respond, or a lot of times the nurse triage responds as well. So in this case, she's looking for help with her diet plan. It's a great opportunity to provide patient educational resources online to her in response. And just two more things. One is around appointments. We mentioned that you can actually request an appointment, and in this particular case, I told her to follow up with me in 3 months. So she's now going to put a request into my office to follow up with me in 3 months, and she can get a response back from our office indicating what time and place that appointment will be. And then finally, on the left, I mentioned the ability to access family records. You can see my family records here, and then this is the place where you'd be able to log into your child's chart or to your parent's chart. Certainly a huge opportunity for you to get engaged in your family's health care as well as your own. So I hope this short presentation really got you excited about MyLG Health. I'm excited about it. I'm hoping to look forward to adding those things for the coming attractions in the future as well. And looking forward to working with all of you in the next years ahead as we engage in our healthcare online. So thank you, Mr. Chairman, for that time.
Thank you. That's obviously a very transformative system for us to have in place, and extremely exciting. Because we're running a little bit behind ourselves, I won't open it up to questions, but I'm sure Dr. Ripchinski will be available here for any specific questions you may have. So if what we will do next is we will adjourn. You can go next door and have some snacks. If there's matters you'd like to ask me about or that aren't on the agenda, Claire McCormick and I, along with Joanne Lagley, who's head of our Strategic Issues Committee, will be available. But the rest of the board members will also be happy to chat with you about what we're doing. If you have any other questions, and we'll come back here at 6:30, and we have 2 more great presentations planned for you. So I hope you'll all come back again. Is there a motion to adjourn?
So moved, Mr. Chairman.
Motion and second. All those in favor say aye. Aye. Thank you very much. We are adjourned.